So, as we have started the anti-tubercular drugs, and in the anti-tubercular drugs we are studying about the first line anti-tubercular drugs. So today we are going to study about the rifampicin. We have already studied or recorded the lecture regarding the isoniazid. So today we are going to study about the rifampicin. So let's start. So rifampicin, what is rifampicin? It is a derivative of rifamycin. It is a derivative of rifamycin, and it rapidly kills intracellular as well as the extracellular bacilli. Intracellular means that those bacilli or Mycobacterium tuberculosis which are present or which have invaded the macrophages and live inside the macrophages. So the other drugs, other antibiotic cannot kill the intracellular, but the rifampicin and isoniazid like drug can kill the intracellular as well as the extracellular bacilli. It can also kill all the organisms that are poorly accessible to many other drugs, like those which are present in the abscesses, in the lung cavities, in the spurters. These are those bacilli which are present in the caseous lesions. As these areas like abscesses, lung cavities, and the caseous lesion are not really accessible to the other drugs, so rifampicin can be used against these bacilli which are present in these areas. It has also a bactericidal effect against the mycobacteria, as we have already discussed. It is against the serum meningitis, H. influenza, Strep aureus, Escherichia coli, and the Pseudomonas. So it is mainly a broad spectrum drug, and it is the only agent that can act on all types of bacillary Mycobacterium subpopulation. Hence this rifampicin is also called as the sterilizing agent. It can kill the rapidly growing Mycobacterium tuberculosis, the latent, the slowly growing, and all kind of subpopulation. Hence it is known as the sterilizing agent. Coming to its mechanism of action, that how does it kills the bacteria. So it mainly binds to the subunit, which is a beta subunit of the bacterial DNA dependent RNA polymerase, and this RNA polymerase form the RNA like mRNA, rRNA, and tRNA, and thus this inhibit the synthesis of such kind of RNAs. But the good point is that it does not bind to the human RNA polymerase, and thus it is highly selective. It is highly selected by the bacterial DNA dependent RNA polymerase. Now coming towards it, how the bacteria develop resistance against this drug. So the resistance is usually developed, and it results from any of the several possible point mutation in the RPOB gene, and this is the gene for the beta subunit of RNA polymerase. So these mutations result in the reduced binding of rifampin or rifampicin to the RNA polymerase, and thus it develops resistance to the rifampicin. This is the mechanism by which the Mycobacterium tuberculosis develop resistance. Coming towards the pharmacokinetics of the rifampicin or rifampin, it is also called rifampin. Keep in mind, it is also called rifampin. It is well absorbed after oral administration, but the presence of food decreases its absorption, so it is mainly taken before the meal. Towards its distribution, so it has a wide distribution in the body fluids and tissue, as we already discussed, but cannot cross the blood-brain barrier, and this adequate cerebrospinal fluid concentration can be achieved only in the presence of meningeal inflammation. This is inflammation. When there is meningeal inflammation, so it can enter the cerebrospinal fluid. It is relatively highly bound to protein. Coming towards metabolism, so it is metabolized by the deacylation in the liver and excreted mainly through the bile. It is then undergo enterohepatic circulation, and mainly the bulk of its metabolites are excreted in feces and a small amount is excreted in the urine. Now, talking about the uses of rifampicin or rifamycin. So, rifampicin can be used for the treatment and for the chemoprophylaxis of the tuberculosis caused by Mycobacterium tuberculei. It can also be used for the treatment of leprosy. It can also be used for the prophylaxis of the Neisseria meningitis or meningococcal and H. influenza meningitis. And we also know that this rifampicin reaches high concentration in the location like nasopharynx, and we know that these organisms, these mycobacteria like meningococci and the H. influenza, in the case of its carrier state, it resided in the nasopharynx. So it reaches the high concentration in the nasopharynx, and thus it can be useful in the eradication of the carrier state in case of the Neisseria meningitis and H. influenza infection. So these are the two uses, prophylaxis and for the eradication of the carrier state of both of the meningococcal and H. influenza infections. It can also be used for the staphylococcal infection like the endocarditis, osteomyelitis, and other skin infections like carbuncles, etc. It can also be used along with the doxycycline for the treatment of brucellosis. So these were some uses of the rifampicin or rifamycin, tuberculosis, leprosy, meningitis, staph infection, and the brucellosis. So now coming towards the adverse effect of the rifampicin. So these are some adverse effects caused by the rifampicin. The first one and the most important one is the hepatotoxicity. It is the main adverse effect, and the risk of hepatotoxicity in much more in people like alcoholics, those who are chronic alcoholics, and in the elderly patients above 50 years of age. 50 years of age. It can also cause cholestatic jaundice. It can also cause flu-like syndrome characterized by fever, chills, headache, muscle and joint pain. It also causes GI disturbance like nausea, vomiting, and abdominal discomfort. Hepatotoxicity, cholestatic jaundice, flu-like syndrome, and GI disturbance. These are the first four adverse effects. The other adverse effects are characterized by the hypersensitivity reaction like skin rashes, itching, flushing, acute tubular necrosis, hemolysis, and thrombocytopenia. These all are due to hypersensitivity reactions. The other adverse effect is in the form of light chain proteinuria, and one of the most important adverse effect is the orange staining of the various body fluids. Although this is harmless, but this can be a great problem for the patients taking these drugs. And this orange staining of the fluids may be of the urine, tears, saliva, sweat, sputum. Now talking about the drug interactions. So keep in mind that rifampicin is one of the most potent microsomal enzyme inducer. It is the microsomal enzyme inducer, and it can reduce the plasma levels of many drugs such as the oral contraceptives, somatic probable in case of contraception, anticoagulants, antidiabetics, HI protease inhibitors, and non-nucleoside reverse transcriptase inhibitors. These both are antiretroviral drugs. It can also induce its own metabolism, not only the metabolism of other drugs, it can also induce its own metabolism. So that was the lecture regarding the rifampicin. We will study about the ethambutol in the next lecture. So kindly stay tuned. Thank you. Jazakallah.